Welcome. At our recent sixth annual Workday Healthcare Summit, we announced the 2020 winners of our Healthcare Innovation Awards. The awards celebrate the success and creativity of our healthcare customers and the impact they have on the rest of the Workday community. We announced winners across four categories: digital transformation, trailblazer, process innovation, and collaboration champion. We received so many great submissions, and each winner really excelled in their innovation. I'm excited to have Lindsay Garrido, Director, Human Capital Management and Total Rewards at Westmed Medical Group, join me to celebrate their recognition as this year's Process Innovation winner. The Process Innovation Award celebrates customers who have shown creativity and innovation in using specific Workday functionality to solve a specific healthcare regulatory business need, resulting in a measurable ROI to the organization. Welcome, Lindsay, and congratulations.
Thank you so much, Keith. Really appreciate it. And thank you for the recognition. I'm Lindsay Garrido. I'm the Director of Human Capital Management and Total Rewards here at Westmed Medical Group. Westmed Medical Group is a large multi-specialty medical practice with a team of over 400 physicians and advanced practice providers headquartered in Rye Brook, New York. We have a team of about 1,500 employees and providers and 13 office locations between Westchester County, New York, and Fairfield County, Connecticut. Our group has about 60 different medical and surgical specialties, and we really aim our mission to be our patient's partner in their comprehensive lifelong care. My role here at Westmed, I oversee our Workday system. We utilize Workday for both human capital management and financial. So we really have a very robust use of the system.
Great. Thanks for that introduction, Lindsay. Your submission focused on something that was, very timely and something that was really critical to your organization. It focused on how you use Workday to support your response to COVID-19. Could you tell us a little more about, what the challenges you're facing and what you did to help respond to this?
Sure, of course. So COVID-19 really created an unprecedented impact on all of us and created a lot of challenging new business needs that had to be met in a short amount of time. For us, especially as a healthcare organization, we were really dealing with a lot at one time, from having staff on the front lines and making sure to keep them safe, to making sure we had the right PPE available, kind of dealing with all of the regulatory guidelines that were coming up and then constantly sort of changing and shifting, as well as having business that, ultimately declined and a little bit of loss of revenue from shutdowns and patients staying home. And we ultimately did have a furlough process. So we really had a lot to sort of deal with and kind of all simultaneously at the same time. And for us, we really leveraged Workday to meet all of those business needs. And we really leveraged the power of one. I don't know that there's an area of Workday perhaps that we really didn't use. We used, multiple business processes, different modules to really be able to meet all of the needs of our business, but also for our leadership team. And we did that through a lot of critical workflows and business processes, while also leveraging Workday to be, for us, an important vehicle for essential communication to all of our employees.
Yeah, and with a workforce that's so diverse, dispersed across multiple locations, I remember from your submission of how you really use Workday as a key communication tool to your employees. Could you share a little bit more about how you used it and the type of information you were using to communicate both to employees, but also then to your people leaders as well?
Sure, of course. So as you know, a lot of information is being continuously shared. And a lot of times for us internally, that would be through email, company calls. And while that's great in the moment, that can sort of get lost or, hard to stay on top of important details. So that's where we really leveraged Workday. And we kind of instantly knew that we wanted to create sort of a one central place where we can keep a lot of different important updates, information, policies. And so what we did is we created a custom dashboard and we called it the COVID-19 Resource Center. We put that on the homepage as the very first worklet for all of our employees. So it's the first thing that they saw. And within this worklet, there was updates, whether that was our own internal company updates, updates from the CDC, giving important website links to tracking of COVID-19, different guidelines. keeping sort of our policies front and center, as well as also giving information on important benefits and mental health resources that were especially critical at this time for our employees. And we wanted to make sure that they had that information available to them and accessible. So we actually made the dashboard accessible off network on the mobile app. We used a self-service domain so that employees could really access that app and access the dashboard anytime, anywhere. So if they were at home on the weekends and they needed to reference information, they could do that. So it really was sort of a one-stop place for all of those things, as well as also for our people leaders. So we utilized different tabs to kind of isolate different content, and we kept the tab specifically for our managers so that they had reports and information accessible to them at any time related to their staff and their team.
And how did your leadership react to having all this information and what you were able to deliver using Workday?
I think that the biggest win, honestly, was that it helped to really foster for them, adoption and the value of Workday to the point that, we're at a point where kind of the immediate answer is, okay, how can we accomplish this in Workday? How can we utilize the system to achieve whatever the business need is at the time? So really through all of the different processes and workflows that we ultimately used, we then created a lot of different analytics and reports that we then were able to share with our leadership team. So we created different dashboards and different reports that, even if we shared it with them via email, we had that information in real time that we could share with them on two very important aspects that really, were impacting us. And that was the financial impact of COVID-19 and how, those numbers were sort of translating month to month, as well as important trends on our staff. So with COVID-19, you're dealing with a lot of staff taking time off, if they're sick or they need to quarantine. We wanted to be able to sort of track the hours and the impacts of that financially, but also be able to assist our managers and assist our teams with realizing, how their staffing was being impacted and time off that would be needed that they would then need to sort of address and reallocate staff to be able to ensure that, the departments were adequately staffed.
Great. And then are you building on this as it continue to go through this second wave of COVID-19?
Definitely. It's honestly a continuous process. We are even working on something right now, sort of, as the cases are starting to rise in the area, and it's starting to kind of go through a second wave, unfortunately. Those needs are kind of picking up. So right now we're working on revamped time off processes to sort of be able to track time off that staff are taking and if it's related to COVID, if it's not, and then also incorporating different steps within those processes. So that's where we really leverage the system because we're, doing a time off business process, but we're also incorporating acknowledgement steps and the ability to distribute documents directly to them, having a to-do step to either help the employee or help the manager, remember an important task that they need to sort of complete before that employee returns back to work. So it's definitely evolving every day. We've, really enhanced certain financial aspects of the system, utilizing projects a lot to specifically isolate certain expenses and staffing hours related to COVID-19.
Wow. Well, it's really, really amazing to hear what you've done using Workday to help support your organization. It sounds like it really contributed to helping you stay in touch with your employees and support them during during the last 9 months. Any final thoughts or advice you're going to share with others who are looking to embark on certain projects like this?
Yeah, I think that, my advice is to just be creative and innovative with the different processes and functionality that exist within Workday. A lot of times they can really go beyond their intended use or label for what they're for. And we've really been successful when we've actually kind of leveraged different modules and different functionality to kind of address a specific business need and what we're trying to accomplish. So again, that's really like the power of one with Workday and has, ultimately kind of helped us to be able to utilize it is that ability to see a little bit past, okay, well, this functionality is for creating a reference letter, but we can actually use it to, modify and distribute important communications to our staff that we want them to receive and acknowledge. And then for us, we're also able to track it. So that's honestly, what I would say to anyone is that the capabilities within Workday go far beyond what you kind of see up front.
That's great advice, and that's what's really amazed me this year is the creativity of our customers and using different capabilities to really pull together new business processes, new dashboards, and everything to really help with all those tracking needs as well. Well, so Lindsay, thank you so much for joining us today and for sharing your innovation and what you've done, and thank you for being a Workday customer. Congratulations again to Westmed Medical Group on winning the Process Innovation Award. Thanks, everyone.
Thank you.